It's time for a Wellness Revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctor.
Now, Dr. Stephen Hotze. Dr. Hotze's Wellness Revolution podcast is brought to you by Physician's Preference Pharmacy, formerly Hotze Pharmacy.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. Thanks for joining us today. And just a reminder, we do have many podcasts with lots of really great information on how to achieve health and wellness naturally. All you have to do is go to hotzepodcast.com. That's Hotze podcast.com. So be sure to head over there as well. So today, Dr. Hotze is going to talk to us about something that's really important. We talk about thyroid quite a bit. But we don't always cover the difference between natural and synthetic thyroid. So if you're out there, you know you need thyroid or you're on thyroid, then you definitely need to hear this podcast. Dr. Hotze.
Thank you so much, Stacey, and thank you for joining us. I believe that you need a doctor and a staff of professionals who can coach you onto a path of health and wellness naturally without using pharmaceutical drugs. So as you mature, you've got energy, you got vim and vigor, you got to get up and go, you got enthusiasm for life. Wouldn't you like to feel that way? Even as you mature, whether you're maturing in your 30s or 40s or 50s, 60s, 70s, 80s, you ought to be brimming with energy and full of enthusiasm for life. And so if you get yourself on a path of health and wellness and some people can help you do that, that's the way you can feel. Now, I believe, though, that you need to take charge of your health. I can't do it. The doctor, and none of your physicians can do it. Your spouse can't do it. The government can't do it. Your insurance company can't do it. Only you can take charge of your health. And you can't control your health or make yourself healthy by taking pharmaceutical drugs, which are toxic. Now, I want to talk today about thyroid preparations. The most common thyroid preparation prescribed in the United States is synthetic thyroid, levothyroxine, which is T4. It's the thyroid molecule that has 4 iodine atoms attached to it. That is called T4 or tetra. Or thyroxine is the formal name of it, thyroxine. It's not the active thyroid hormone. It's the inactive thyroid hormone. It has to be converted inside the cells to T3. That's called triiodo. Tri for 3, iodo, 3 iodine atoms, thyrine, so attached to the thyroid molecule. When most people go to a physician relies strictly on blood tests to determine whether or not you have hypothyroidism. 95% of the people on routine blood tests fall within a broad range of normal. 95%. So the range is as tall as the Empire Building, wide as the Grand Canyon. You can't hardly be out of that range. And interestingly, as time has gone on, the range gets lower and lower, because the people that are getting their thyroid checked are getting older and older. And so we're dealing with an older population, and thyroid levels decline as we age. So you go to a doctor, and if you fell out of the range and they put you on thyroid hormone, they inevitably will put you on a synthetic thyroid hormone, T4, with 4 iodine molecules. It's not even active. And this is either Synthroid, levothyroxine, levothyroid, one of those synthetic preparations. The most popular is Synthroid, a name brand. It's a T4 preparation. If you're taking a preparation for low thyroid condition and you're not having any change in your symptoms, you're still fatigued, you can't lose weight, you can't think clearly, your body temperature's low, you can't sleep, you got joint muscle aches and pains, you got sluggish bowels, recurrent infections, you're puffy, pale, and you don't feel well, and you're taking the preparation, is it working? Oh, you go to your doctor and he says, oh, now your blood tests are normal. Well, you can normalize the blood with the synthetic thyroid that isn't active within your cell. It has to enter your cell, and there it has to be activated to the active hormone T3, which then catalyzes energy production within your power plants of your cells to make electrical energy. Those power plants are called mitochondria. So if you don't get enough active thyroid hormone T3 into the mitochondria power plants, your metabolism is sluggish and it's slow. So what we recommend is, and when your body we recommend to do what your body does. Replenish your thyroid with not only T4 but T3. So we make sure we have T3 in the preparation. The best preparation for this is desiccated thyroid, and we also make another compounded preparation that has T4, the inactive thyroid, and T3 in it in the same proportion that your body produces, so that we can, and what the T3 does is it activates the deiodinase enzyme that cleaves off one of the atoms on the T4 molecule. It activates that, so you make proper conversion, and people do much better and feel much better if we convert them from synthetic thyroid to the active thyroid hormone. It does much better, and that's what I'd encourage you to do. You know, if you're taking a synthetic thyroid hormone, ask your doctor if you can take desiccated or natural thyroid hormone. Inevitably, they're going to go, well, we don't know, it doesn't work very well. Well, listen, we've treated over 30,000 patients here at the Hotze Health and Wellness Center with natural desiccated thyroid, and they've done wonderful. Overall, have done wonderful, and that's what we do. And we've seen literally thousands of the individuals that we put on desiccated thyroid were on synthetic thyroid, and we're doing well. Now, there may be some people that take synthetic thyroid and do well, but we don't see them here at the Hotze Health and Wellness Center. People are coming here because they're not doing well on their preparations, and we simply switch them. My philosophy is this: even in individuals who have normal blood tests and have never been on thyroid, if you have the symptoms of low thyroid, then I believe you need a therapeutic trial of thyroid to see if that will improve your overall health. That's the way we operate here, and we follow your blood test, make sure we don't get it out of range, but we know that people do well. The vast majority of the time will do well, exceptionally well, if you get them on the proper dose of thyroid when they're having the symptoms of hypothyroidism. So I want to encourage you to get yourself, if you have the symptoms of low thyroid, you can go check on our website, go to hotzehwc.com and do the symptom checkers. See if you match up. See if you have the symptoms of hypothyroidism, and then
you can give us a call, 281-698-8698. That's 281-698-8698. And obviously, for those of you out there who are already on Synthroid, you just learned now it does not have the active form of the thyroid in it. So if you haven't been getting a resolution of your symptoms, then that's why.
You know, I want to hand me that book right there, Hypothyroid, the blue book right here. Yeah, I want to offer. If you would like a copy of this book, Hormones, Health, and Happiness, then just give a call to our office.
Actually, I think it's hypothyroidism.
I'm sorry, Hypothyroidism, Health, and Happiness. What did I say?
Hormones, your first book.
That's my first book. So this is Hypothyroidism, Health, and Happiness, and I talk about T3 and T4, the active versus the inactive thyroid hormone in this book, and this will be very helpful to you if you think you have the signs and symptoms of low thyroid, but your doctor will not diagnose you as that, and he just wants to give you antidepressants, sleep medication, anti-anxiety medication to kind of mask your symptoms. I encourage you to get a copy of this book, and you can get that by simply calling 281-698-8698 and ask one of our new guest consultants for a copy, and we'll be glad to send it to you.
Thank you, Dr. Hotze.
You're welcome.
And thank you out there for joining us today on Dr. Hotze's Wellness Revolution.
A special thanks to Physicians Preference Pharmacy, formerly Hotze Pharmacy, proud sponsor of Dr. Hotze's Wellness Revolution podcast.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.